Hello, my name is Paul Geelen. I'm an ocularist from Western Australia and I also consult at Moorfields Hospital in Dubai. This is the third talk in a series we're talking about on adjusting and adapting to eye loss. So we've talked about the operation, and 8 weeks after the operation we make the artificial eye, and then it's time to learn how to look after the artificial eye. How do you maintain your artificial eye? So basically, we recommend that you try not to meddle with the eye too much at all. If you take it out maybe once a month for cleaning, we don't recommend you use a lot of chemicals to do this. In fact, definitely don't use alcohol, don't use Dettol, and don't use abrasives. Don't use anything abrasive on it because it is just a plastic surface on the artificial eye, and if you go rubbing it with abrasives, you're going to scratch it. Alcohol will actually eat into the plastic and will damage it. Certainly don't recommend people taking their eye out and putting it in people's drinks because it really can damage the artificial eye and is also pretty disturbing. So how do you clean an artificial eye? We recommend that you just use a wet tissue under the tap, give it a good rub with a wet tissue, and that will remove any protein that will build up on it. Your eye socket still has the tears, so the tears will still function. You'll produce tears. The blinking motion of the lids will clean the front of the eye, and the drainage still works as your normal eye does. You're still able to cry normally as before, which is very therapeutic and also good for cleaning the artificial eye. If you feel that you can't get to the end of the month, some people do produce more protein, and some people also have other issues with the artificial eye. So if your eye doesn't close properly when you sleep at night, it won't shut, and that means it's going to get dry. And when it gets dry, that means your eyelids are going to stick on it and it's going to be a bit uncomfortable, so you might have to take it out more often. If you are getting this, you can use silicone eye drops which prevent it from drying at night, but in the morning, if you have your eyes dry, just put a wet gauze or a wet tissue over it, hold it there for 30 seconds and then just give it a wipe. That will soften everything up to make it more comfortable. If you need to use something stronger than water when you're cleaning it, there are a couple of very good cleaners. So there's cleaners for hard contact lenses. You get the little bottle, you shake it to make sure that the contents are all mixed properly. You put a bit into the back of the artificial eye and you give it a good rub with your thumb. This has got a polishing agent in it. You have to be careful that you don't put it into your eye. It does look like an eye drop. It's not an eye drop, it is soap. So you put it on the eye, you give it a good rub all over, and then you rinse it. And it is soapy, so you'll feel when the soap is all washed off, and then it's ready to return back into the eye socket. There's also an ultrasonic cleaner that you can use. This is very good for cleaning artificial eyes, and basically you put the artificial eye into the ultrasonic cleaner, you put a small little scoop of the powder with it, you run it for 5 minutes, and this will loosen anything that's stuck to the front of the artificial eye. So yeah, basically it's a bit like with your teeth. You can brush your teeth every day, but sometimes you need to do a little bit extra and go to the dentist every 6 months to get the plaque removed. This basically happens to your artificial eyes as well. You can get this plaque or this protein that sticks to the surface, and maybe that needs a bit of extra effort to get it to come off. With the artificial eye, we recommend you come back every 6 months to a year to have it polished. It is plastic and it comes to a nice, we can polish it to a nice hard shine, which is makes it look very natural. Over a period of time, just with particulates in the air and dust, you can sort of get dull and a bit scratched. So every 6 months to a year, come back in, we'll polish the artificial eye for you. It takes 10 or 15 minutes and it certainly feels a lot more comfortable after it's done. The interesting part of this is, how do you take an artificial eye out? This is an uncomfortable thing to do at first because we're taught from a very young age, don't touch your eye, and now you have to touch the eye to take it out. So how do you take an artificial eye out? Well, I recommend that you use a suction cup. This is a small little tool that makes things a lot easier. This is a DMV suction cup. They come in two types. There's a large one which you have to squeeze the air out of before you put it on, and then that creates a vacuum. This one here, you just wet it and you put it on the front of the artificial eye and it creates a good suction. So basically, you put the suction cup on the middle of the shell at the front and you want to lift it up slightly. The plan is to get the artificial eye to come out over the bottom lid. So you need to pull the bottom lid down slightly and then lift it down and out. The reason you do this is basically the artificial eye sits over the ball in the back, and if you just pull it out, it could scrape across the front. And this can scratch the back of the eye socket, which makes it uncomfortable. So what you want to do is you want to lift it forwards and down and over the artificial eye. To put the artificial eye back in, you want to lift up the eyelid. You want to make a nice gap under the eyelid. You push the artificial eye up underneath the eyelid, and then you want to pull the bottom lid down, and it will just sit into place. It's very easy once you know how to do it. We have children who are 3 years old who will come in and they'll just come and take their artificial eye out and give it to us. Sometimes they'll take their eye out in shopping centres or other inappropriate times. But really, it's not a difficult thing to do. It's just a bit of an uncomfortable thing to do, and we'll show you how to do it. So once you've done it a couple of times, it will be a lot easier. I hope this helps you with maintaining your artificial eye, and thank you very much for watching.